All right, so let's start with the big story that we are tracking on WION, where a grim tally has now brought back the focus on Japan's mental health crisis. Now, this, as data released by the government, has revealed that more people died by suicide in Japan than by COVID-19 this year. In Japan, suicides in till the month of October this year have claimed more lives than the coronavirus did in the whole of 2020. Now, according to data that has been put out, nearly about 2,153 people died by suicide, while the country's total COVID death toll is 2,087. Now, unlike most countries, the impact of COVID-19 has not been very severe in Japan, but a deeper analysis shows that the country's existing mental health crisis has been made worse by the pandemic. Now, Japan is the world's second highest suicide rate after South Korea. Long working hours and also societal pressure coupled with stigma around mental health are said to be some of the factors behind the grim figure. However, the recent data suggests that COVID-19 has taken a disproportionately a higher toll on women. While more men than women have died by suicide, the number of women taking their own lives has been on the rise in Japan. The suicides amongst women in Japan increased by nearly about 83% in comparison with the male suicide rate that has risen by about 22% over the course of the last year. Now, many women who were employed as contract workers lost their jobs during the COVID-19 lockdown. This as women make up a larger percentage of part-time workers in the hospitality and retail sectors that have been hit hard by the pandemic. There's also been a sharp rise in incidents of sexual abuse and domestic violence. This is unlike women before have now been forced to remain confined to their homes even if they face a hostile and an abusive environment at home. Women have also been overwhelmed due to the increased responsibilities at home that includes looking after of children as schools and daycare facilities remain shut. It must also be noted that Japan remains an extremely patriarchal society where the household work is rarely divided between men and women. And now to give us more perspective in terms of what these figures actually tell us, we're joined in by Grace Lee, who's joining us live from Tokyo. Thank you very much indeed, Grace, for joining us on this broadcast on WION. Now, this recent bit of data that has come forth points to a pretty shocking incidence of people who die by suicide, which is far higher than a pandemic that is raging this year in Japan.
Yeah, and unfortunately, according to analysts, Japan is one of the few developed countries that releases suicide data very frequently and very up to date. For example, the last known set of data that we have from the U.S. is from 2018. So we are seeing close to real-time numbers of what suicide data looks like here in Japan. And so analysts say that perhaps this is indicative of what we are seeing around the world, although we may not have the data yet of how much COVID-19 is having an impact on mental health. And of course, you mentioned that women were disproportionately higher to be susceptible to suicide. And that, of course, does point to the fact that many women have been suffering from the added burden of childcare issues that have come up through COVID-19. And we are seeing a lot of that here in Japan, but women around the world are suffering from that hit.
Absolutely, indeed. I'll discuss a bit about how women have been badly affected, much more than men, during these COVID-19 lockdowns. But I want you to dwell a little bit more, upon some of the factors that are said to have contributed to this high rate of suicides in the Japanese society. Extremely long working hours is said to be one of those factors. Is there now a concerted policy on the part of the government to try and somehow decrease the long working hours that are pushing people to suicide?
Well, there's been efforts for decades from the Japanese government to try and bring down their suicide numbers. And on a larger level, it has been rather successful. We had seen suicide numbers going down in the past few years. But of course, the pandemic has just made those efforts kind of go to waste because of the fact that we are seeing a large host of mental health problems that arise from confinement, from the loss of jobs, from the economy being hit hard, and overall from being trapped in very small spaces that we have here in Japan. A lot of the apartments are much smaller, and people feeling isolated, not being able to reach out for help because of the stigma surrounding mental health. All of those are contributing factors to that rise that we're seeing here today, according to experts. And they do worry that with the the third wave of COVID-19 that we're seeing here in Japan, we saw about 2,000 cases per day across the country for the past few weeks, 500 per day on average here in Tokyo alone. And they say that this is perhaps the worst wave of COVID that we've seen in Japan so far. And so they are bracing for even more issues to come up due to this third wave of the pandemic as well.
Absolutely, indeed. Now, talking about, how COVID has impacted women much more disproportionately than it has men in terms of how it has changed the economy. Because with the lockdowns, what has happened is, a lot of these informal jobs, a lot of these jobs that were on contract basis, in which, unfortunately, women seem to be employed, proportionately higher. These are the ones that have taken a hit. How has this impacted, the role of women taking up jobs in Japan?
Absolutely, and I've spoken to a lot of economists about this very subject even before the pandemic was starting to take its toll on job losses here in Japan. They worried about the fact that a lot of women here in Japan were working part-time, were working freelance. They were working jobs essentially that would be the first to be let go during a situation like a pandemic. And so we are seeing a disproportionate amount of women losing their jobs and not having any social security or a social network or any kind of network to help them get back on their feet after losing their job during the pandemic. And then they have that added pressure of childcare if they have children, all of these factors, and the rise of perhaps domestic abuse and not being able to reach out for help during these difficult times. A lot of contributing factors to this, and experts are just trying to get the message out there that there are help networks out there. If they Google it on their phone, have more women call in for help. A lot of the younger generation seem to be communicating through text to help networks, so they're trying to increase the amount of suicide prevention centers that are communicating through text and can provide that service. So those are the kind of efforts that are being implemented here today.
All right, we'll have to leave it there. Thank you very much indeed, Grace Lee, for joining us from Tokyo and getting us all those updates there.